welcome everybody, it's a great pleasure of mine to be able to spend some time with you all this afternoon. We've got some time, I think, Annika, for a Q&A at the end as well, if that's something that you would like. So if you have any questions, just feel free to punch them out in the chat question, and Annika will either interject. I'm happy to do that, Annika, on the way through, or we can save them up and answer them at the end. But hopefully, after the end of this presentation, you know a bit more about the Pharmacy Guild of Australia, you know a bit more about community pharmacy, not just now, but where the Guild is driving the practice of community pharmacy into the future. So hopefully, you know, you come out knowing what I know and what most pharmacists in Australia know, that the best place to practice our profession is in a community pharmacy setting. So community pharmacy does make up about 2/3 of the 35,000 registered pharmacists in Australia. So 63% of community pharmacists are female, which is quite a great statistic that we're very, very proud of. That's not something that existed in the 1990s. It's been something that's evolved over the past 2 decades. And that really is because of the flexibility that community pharmacy provides to be able to flex up and down from full-time to part-time, to be able to work not just traditional hours during the week, but non-traditional hours on nights and weekends, which suit a lot of people who are wanting to balance not just work and life, but family commitments as well. So even though we've got, as I said, 63% of community pharmacists are female, we still only have about 1/3 of pharmacy owners are female. That's why 1/3 of my national council are female as well, so that my board is truly representative of my membership base. The Pharmacy Guild of Australia represents over 80% of all of the 6,000 community pharmacies in Australia. So just to put that into perspective, some of the other organisations in our profession have about 16 and 17% membership. We have 80. A lot of the medical lobby groups as well are closer to 10% than they are 20%. So having a voluntary organisation like the Guild and to have such high membership rates, I think is testament to our great connection that we have with our members. Now, the Community Pharmacy Network is the most accessible piece of primary healthcare infrastructure in Australia. Because of the location rules that have been in place since the 1st of July 1990, so just over 22 years, 32 years, goodness, so that they've been in place, has ensured that unlike other elements of primary care that have clustered not only in metropolitan areas, but in wealthy metropolitan areas, community pharmacies are distributed not only in outer metropolitan working class society, but also right across regional, rural and remote Australia. Now, the average Australian visits a community pharmacy 18 times a year. Most community pharmacies, so over 50% of the 6,000 network, are open extended hours, which is either nights and or weekends. And as I said, not only does that make us the most accessible piece of primary healthcare infrastructure, but it also means that we can offer the most flexible terms of employment for people who are wanting to work with us, whether they be pharmacists or pharmacy assistants alike. So we are a registered organisation under the Fair Work Act, and we have been so since 1928. So we were established in 1927 on the 7th of the 11th, 1927, which means we are approaching our centenary. So Pharmaceutical Defence Limited, a sister organisation of ours that I'll talk about in a moment, is the oldest pharmacy body in Australia, closely followed by the Pharmacy Guild of Australia. And then there is at least 75 years before any other body appeared on a national level. So we've been doing this an awful long time. But the organisation that is the Guild now in 2022 is very different to the organisation that was established in 1927 to just do industrial relations. So not only do we have a learning management system to help you with your continuing professional development, to help you with your upskilling and your path to full scope of practice, and I'll talk about that later in my presentation. But we also own the Quality Assurance Scheme QCPP, which means that the industry is self-regulated to a large extent to ensure that we can drive the practice of community pharmacy forward. We benchmark ourselves on an international level through the World Pharmacy Council to make sure that the practice of community pharmacy in Australia remains cutting edge. We've got a while to go on the scope, but as I said before, I'm going to talk to you about that in a moment. So not only does the average Australian visit a community pharmacy 18 times a year, more than they visit their GP, more than they visit their community-controlled Aboriginal health centre, more than they visit, thank goodness, an emergency department. But we dispensed over 300 million prescriptions through the Pharmaceutical Benefits Scheme last financial year. I've got some information on vaccinations coming up as well. Things that we do for our members. Not only do we negotiate the community pharmacy agreement, and I'll explain that in a moment as well, but we also represent them. We also represent them not just at a Commonwealth government level, but at a state and territory level as well. So the last 24 months has been exceptionally stressful. It hasn't just been stressful, I can only imagine, for people wanting to have a normal university life, whatever a normal university life is nowadays. I couldn't imagine my uni days without being able to go to a toga party or a pub crawl, or being able to go to a face-to-face compounding workshop. And a lot of you have had to transition to virtual lectures over the past 2 years. But for those of you that have worked in community pharmacy or are working in community pharmacy, you'll know that we stood up. We were there when others closed. While others transitioned to telehealth and telemedicine, community pharmacy remained open. And we were, more often than not, the only port of call. Because you didn't go to an emergency department, you couldn't go see your general practitioner. So all of that extra care was put on the shoulders of Australia's community pharmacists as well. But listen, times of great disruption are also times of great opportunity to take the profession a leap forward and to really accelerate the pace of change. Now, change can be really tiring. And if I have a chat to my members, if I have a chat to people working in community pharmacy, they're tired. Right? And there's a reason they're tired, because look at the vaccinations that they've given. Over 8.5 million now, so just over 8.5 million COVID-19 vaccines have been given throughout the community pharmacy network. And on top of that, there's been about 3 million influenza vaccines given this calendar year alone as well. Now, it was only in 2014, might seem like a long time ago for someone that's 19, 20, 21, but I can assure you, in terms of the evolution of our profession, 2014 was just yesterday. We could not administer any vaccines, we could not put a needle into an Australian's arm. And to go from that very first influenza vaccine administered in Queensland only 8 years ago to now giving 3 million influenza vaccines to Australians 4 years of age and over, and giving over 8.5 million COVID vaccines to Australians 4 years of age and over, is a phenomenal change in the way in which we interact with our patients. Now, the Guild staff in Canberra refer to pharmacy vaccinations as something that has a bit of a halo effect around it, because really a pharmacist has been somebody that's been, whilst accessible, someone that didn't have a physical interaction with our patient base like medicine or nursing or physio or dentistry. But having that tactile relationship, having that touch now that is required for us to administer it, really has elevated the perception of community pharmacy in the eyes of the Australian public. And we monitor this. Community pharmacies are the second most trusted healthcare profession, community pharmacy specifically, as opposed to other areas of pharmacy practice, second only to Australia's wonderful nurses. So government and public relations are things that the Pharmacy Guild of Australia lead on behalf of all pharmacists in Australia. And last year in 2021, when we were going through that immense period of disruption and change, we had to increase the amount of times that we were in contact with our membership. So what we did is we made all of our webinars open source. So every community pharmacy owner, every pharmacist, every pharmacy assistant employee, every student, anyone who was involved in the pharmacy profession could access our fortnightly webinars. And we had prime ministers and health ministers and assistant health ministers. And we had the Lieutenant General who was in charge of Operation COVID. We had shadow opposition leaders. We had shadow health ministers, anyone who was anyone in leadership roles in Australia. We had the governor of the state of Queensland, Dolan. We had chief medical officers and chief health officers. We had the professors who were the head of the Therapeutic Goods Administration. No other organisation in our profession gets access at this level, and no other organisation had them lining up to get onto the Pharmacy Guild of Australia's fortnightly webinar to talk to all of you. And students are still eligible to come to Pharmacy Guild events, and I'll talk to you about some of those in a moment, whether it's our conferences or our road shows, but any webinars of ours, you are more than welcome to attend for free, of course. So I mentioned government relations and public relations. So government relations is the specific task the Guild does on behalf of the profession, interacting with the Commonwealth and state and territory governments. But public relations is the specific role that the Guild leads on behalf of the profession, with speaking to the broader public. So this is whether it's us being on the Today Show or Sunrise or Sky News or The Project, whether it's us being on the front page of the Australian or the back page of the Fin Review. These are all the things that we do, not just on behalf of all of you, but on behalf of all of those patients that we are responsible for and have such a sense of duty and sense of care to. So we partnered with the Commonwealth Government. The Commonwealth Government came to the Guild. And our logo and their logo were side by side in a multi-million-dollar public campaign towards the back half of last calendar year to tell people to roll up their sleeve to get their vaccine, but not just to roll up their sleeve and get the vaccine, but to ask their pharmacist for their COVID-19 vaccine. So those 8.5 million vaccines didn't just happen. We used social media platforms, we used mainstream media platforms to drive people to their local community pharmacy and to really elevate the perception of community pharmacy in the public's eyes, and it worked. So I'm sure you've all heard of an organisation called Get Up, and that is a public campaigner, an independent campaigner that gets involved in state and territory and Commonwealth government elections, and they swing behind certain campaigns, usually those environmental and social in nature. Well, I'm pleased to tell you all now that the Pharmacy Guild of Australia's database, as a result of the Ask a Pharmacist campaign, the findapharmacy.com.au campaign regarding COVID-19 vaccines and rapid antigen tests, and of course now the oral antivirals, means that the Pharmacy Guild of Australia's professional service platform, the things we use to do public health campaigns and tell people where they can access not only COVID-19 tests and prevention vaccines and of course the antiviral treatments, but where they can get their flu vaccine, where they can get access to things like urinary tract infection, antibiotics to treat urinary tract infections. We now have more Australians on our professional service database than Get Up, which up until Easter this year had been Australia's largest campaigner. So now the community pharmacy profession has the largest database and is the largest campaigner in the Commonwealth of Australia. We don't do this alone. So whilst the Guild leads and we have the resources and resources doesn't just mean money, friends, right? It means having the talent and the people. We have over 450 staff across our national office and our state and territory branches, but it means forming coalitions and networks. And I just want to give a shout out to Pharmaceutical Defence Limited, as I said, the oldest body in pharmacy in Australia, who provides all of the professional indemnity insurance to make sure that if something ever goes wrong, they're there to help you. But also the Australasian College of Pharmacy, which was founded in 1978 to be the professional service body of choice for professional development, continuing professional development. The three of us teamed up and we produced these one-page flyers. And this is just one particular example on the AstraZeneca COVID-19 vaccine. But of course, we did ones for Pfizer and all of the different vaccines, but we also did them for the COVID-19 treatments to make sure that we did the legwork for you. So whilst state governments were handing down directions, the Commonwealth governments were handing down directions, and these things were changing not just on a monthly and weekly basis, but often on a daily basis, there was a single point of truth that you could go to not only help you counsel your patients on potential side effects and risks, but also who was eligible for all of these things, as that was a constant moving feast as well. So a big shout out to PDL and the Australasian College of Pharmacy for partnering with the Guild there. We also had not just those political webinars that I chaired, but we also had a whole series of videos and webinars and continuing professional development modules to help upskill people through all of those new emerging therapies as well. And of course, all of those were freely available to everybody. We ran another campaign this year, and this is the largest ever public campaign that the Pharmacy Guild of Australia has run in its nearly 100 years. It cost millions upon millions of dollars, but it was completely patient focused. I'm sure you've all heard that cost of living is a really big issue for Australians at the moment, for families, for old age pensioners who are living on a fixed budget, for students who have limited incomes, but growing costs of living as well. Now, Australia does not have a universal healthcare system. We have free hospital, sure. We have the NDIS, the National Diabetes Insurance Scheme, sure. We have Medicare, which enables free bulk billing access to GPs and free pathology. But we do not have universal healthcare because the pharmaceutical benefit scheme is not universal. Depending on what postcode you live in, depending on how much money you earn, depends on how much you pay. And this is out of kilter with the rest of the developed world. It is far cheaper to get medicines in the United Kingdom. It's far cheaper to get medicines in France or Germany. It's far cheaper to get medicines in New Zealand than it is in Australia. Now, sure, there's America and Canada, which are the basket case of access to essential medicines. But what the Guild did over the course of the May 2022 federal election was argue for a further investment in reducing the out-of-pocket expenses for medicines in Australia. We didn't talk about ourselves. We did not ask for money for pharmacy owners. We did not ask for money for pharmacists. We asked for money for our patients. This is the very big difference between the Guild and other bodies in our profession and the Guild and other bodies in other health professions who talk about themselves. We never talk about ourselves. We talk about all of you. And most importantly, we talk about all of our patients. Now, the only piece of health policy at the 2022 federal election that received bipartisan support, I'll repeat, the only piece of health policy that received bipartisan support in the election was the Guild's initiative, and that was to reduce the out-of-pocket expenses. We did it first and foremost to have a cost of living initiative to ensure that people could afford the medication that was prescribed for them. The co-payment for a general patient currently stands at $42.50. It will reduce down to $30 on the 1st of January 2023 in just over 5 months' time. This is the first time in the history of the pharmaceutical benefit scheme that it has ever gone down instead of up on the 1st of January. So I just want to say thank you to all of our partners that assisted us with this, the Australian Patients Association, all of the different industry groups for the particular disease states like the Heart Foundation, the Asthma Council, all of those people that partnered with us to make essential medicine cheaper for Australians. Now, we did this for you too, because the profession you are going into needs to be about the clinical things you can do for your patients and not about whether or not the pharmacy gives the dollar discount or can you price match a pharmacy down the road. We want to increase the clinical component of the conversation that you're having with your patients, and we want to decrease the price component of the conversation that you're having with your patients, not just for better health outcomes for our patients, but for a more professionally satisfying career for all of you. So scope of practice. Now, what is scope of practice? Scope of practice are the things that you can do to help Australians stay healthy. Now, we are the medicine experts, always have been, always will be, but we cannot do all things for all medicines for all people. And that's what scope of practice is. I said before that Australia is the best place to be a community pharmacist in the developed world. But you know what? We have the narrowest clinical scope of practice in the OECD, which is the Organisation for Economic Cooperation and Development, which means if you all got on a plane and went to another developed country, Canada, the United Kingdom, you would be able to do more things for patients with your existing training and knowledge. So what things are we talking about? Well, to do all things for all medicines for all people, we need to be able to do the 4 things on the screen. We need to be able to prescribe medicines. We need to be able to dispense medicines. We need to be able to administer medicines, and we need to be able to review medicines. All medicines for all people. At the moment, we can dispense everything and review everything, but we can't prescribe everything and we can't administer everything. And this is the journey the Guild is leading on behalf of not only all of our patients in Australia, but all of you. So we bequeath to you a more professionally satisfying career than the one that we all went into. So it's a very big journey. It is something that not only requires state and territory legislative changes, but also something that requires proper remuneration from a Commonwealth government. So once we get to full scope, you'll be able to prescribe, dispense, and administer and review all medicines for all Australians. Now, we need to make sure, right, that the community pharmacy you walk into has all of the support that you need to not only be able to do all of those things we just discussed in an effective way to have a good health outcome for the person in which you were doing them for, but to do them in a safe and supported way. So the full scope of practice agenda is about patients and practitioners. But what we've got is another piece of work, and that's called the framework for change. So just as the first one was about the patient and the practitioner, this one is about the practice. It is about all the things we need to change within the practice. So within the community pharmacy four walls to ensure that we free up your time. That if we can put robotics and automation in to save you time on doing traditional things like dispensing, it will free up time for you to have a more intimate conversation with your patient. If we can upskill our pharmacy assistants to take over some of those lower level functions off you, like ordering drugs, putting drugs away, balancing the controlled drug safe, about meeting and greeting people for a vaccination clinic, about drawing up syringes and doing dilutions, about helping in the compounding lab, the technical aspects of what we do, not the clinical aspects, not the cognitive aspects, but the technical aspects, will create capacity for you to be able to do all those more professionally satisfying and enjoyable things. So this is what the Guild is probably best known for, and that is our government relations. So the photo on the left of the screen, that's my predecessor, George Tambassis, signing the 7th Community Pharmacy Agreement with Greg Hunt, the previous Health Minister. There's me standing in the back row between the Prime Minister and the Deputy Prime Minister of the day, and that's our wonderful Executive Director, Suzanne Greenwood, who runs everything down here in Canberra. But on the right-hand side, that's my executives. That's all the branch presidents from around Australia that run the Guild in every state and territory, and right dead set in the middle is the new Prime Minister of Australia. That is the dinner that we had with him the week of the federal election. I'm standing here in Canberra right now, and I have dinner with him again this evening. Those ties, they're our uniform. Whenever we do something on TV or in a newspaper, you'll always see us wearing our white coat because we're talking to the Australian public. But whenever we do stuff politically in Canberra or in Brisbane or in Sydney or in Melbourne or wherever it is that we do, we always wear this uniform. It's a highly recognisable scarf rather, and it's recognised instantly by premiers, chief ministers and prime ministers. Now, the Community Pharmacy Agreement isn't just about how the profession is going to function over the 5 years that covers it. It also talks about a vision for the future of pharmacy. And I just wanted to highlight this particular clause of the agreement, 12.4, which is titled Doctor of Pharmacy. Now, when I did pharmacy, it was a 4-year bachelor. In the 1990s, the most prevalent degree was a 3-year bachelor. Right now, in 2022, most of you will be studying because the most prevalent degree is a BPharm Hons. But you know what? In the future, you won't do a 4-year bachelor with honours and then go and do your 5th year of intern. Those 5 years will all be rolled up into one Master of Pharmacy. We are a highly skilled, highly trained profession, but because we still have a bachelor degree, the system of government doesn't recognise us for the highly trained professionals that we are. So it takes 5 years currently to train a pharmacist, and it will still take 5 years to train a pharmacist. But that 4-year bachelor plus the 1-year internship will be rolled up into a 5-year master's. And graduates of this particular degree will be able to use the title doctor. So you will be Dr. Joe Smith, Dr. Mary Jane. You are not a medical doctor, you're a pharmacy doctor. and all of those things that I spoke about before, the prescribing, the dispensing, the administering, the reviewing of all medicines to all people, all of the new skills and knowledge that are required to do those things are going to be embedded into this new degree. Now, people like me that are already out there practicing, we're going to have to go and do a top up or an extra piece of education. That'll probably take about 12 months, which will involve not just the missing gaps of theory, but also the missing gaps of practical experiential placement under other prescribers as well, to ensure that we're as highly trained as you all are going to be when you get out to join us all. So some of the things in the community pharmacy agreements, these things didn't exist in 1990 when we started, but now we don't just get paid by the Commonwealth to dispense medicines, we get paid to do reviews, we get paid to do rural placements, and there's money in there for students as well to go and do rural placements. So each and every agreement we do, we evolve the payment structure so that there is not only a system there for you to utilize all of your skills and knowledge, but most importantly, one of the barriers to Australians receiving the service, which is can they afford to pay for it, is removed. So right now, where we stand, a good example for you all to understand what I'm talking about is if someone goes to a GP to get their influenza vaccine, they can get it for free. If they go to their community pharmacy to get it, they have to pay, right? So we need new payment models so it's free whether they go to their GP or free whether they go to their pharmacy. So that's why there's still probably about 6.7 million flu vaccines given through general practice, whereas I said to you before, there's about 3 million vaccines given through community pharmacy because they're free and they have to pay. And really, it should be no skin off the government's nose whether they're paying a pharmacist to do it or a GP to do it. Newer enhanced community pharmacy initiatives and services. As I said, more affordable medicines. We had a big win on that, going from $42.50 down to $30, but there's still a ways to go to reduce out-of-pocket expenses for Australians. E-health is a huge one. Only 3 years ago, we couldn't access the My Health record through community pharmacy. A GP could, but a pharmacist can't. Now every pharmacy can do it. In the state of Queensland now, the community pharmacists can dial into Queensland Health and access all Queensland Health records, pathology, radiology, dispensing, inpatient notes, because the purpose of the primary healthcare system is to keep people out of those expensive hospitals and living productive lives out in community in their own home. So the community pharmacy model through electronic health is becoming a more and more integrated part of that healthcare sector. This is my last slide. But I just wanted to say the Pharmacy Guild of Australia, despite what you may hear, is driving scope of practice like no other body. The Pharmacy Guild of Australia is out there fighting for patients like no one else. Community pharmacy is not only the most highly paid, I'll repeat that, you get more money being a community pharmacist than you do working in any other setting. If you have heard different, you have heard wrong, right? Community pharmacy is the best paid part of the pharmacy profession. It may not have been so a couple of years ago, but I can assure you it is today. I can assure you it is today. But we also have huge assets, and these assets are there for you. Remember, they're not mine. I might be the national president, but I'm just the custodian of this office. They're all there for not only every pharmacy owner and every pharmacist and every pharmacy assistant, but they're all there for every pharmacy student as well. It's to help you transition from uni into a full-time job, and then hopefully one day owning your own practice as well. If any of you are interested in becoming an owner, come on up to Cairns. I'll sell you one of my pharmacies, or if you want a small share, I'll take you on as a partner, and you can work with Georgina, my wife, and I. And that statement is just as true for the 15 other national councillors from right around Australia and the 95 branch committee members right around Australia as well. There are business opportunities, clinical opportunities. There is great remuneration and good work-life balance being a community pharmacist. But if they're the best way for you to be able to avail yourselves of all of these opportunities is to join, and it's free, right? So not only do I want you to join the guild so I can interact with you like this on a more intimate basis, but I want you to come to our events. It's free for a student to come to APP. It's free for a student to come to Pharmacy Connect. It's free for you to receive all of our newsletters. It costs a lot of money to the Pharmacy Guild to be able to give you all of these things for free, but guess what, guys? You're worth it. So another way that you can not only interact with the guild, but interact with all of our members to try and find an opportunity for part-time employment. I worked in a community pharmacy all the way through my university, and it made me a better registered pharmacist when I came out. So we've got this free tool for you all. It's like a dating app for a pharmacy student with a community pharmacy. But you know, if you don't like apps, just Facebook us and we'll find you a job. I can absolutely promise you. So you are the key to your own success. No one handed me anything on a platter. No one offered me a partnership. No one offered me the guild presidency. No one offered me ownership. I got off my bum and I asked for it. And you know what? That's the hardest part. So the world's your oyster. Anything that the guild can do, anything that I can do to help you on your journey, whether it's being a mentor, whether it's getting you a job, whether it's helping you team up with somebody who's looking for a business partner, please just send me an email, send me a Facebook message. I'd only be too happy to hear from you. So Annika, back to you.
Awesome. Thank you so much, Trent. That was very insightful and detailed. I'm sure everyone benefited immensely from that presentation. We do have a couple of questions.
Sure.
The first one's from Rashna. They ask, do you think we'll be seeing monkeypox vaccines in community pharmacies anytime soon?
Whether it's soon or not, I do not know. We've already had monkeypox in Australia. So, mate, it's on our full scope of practice agenda, all medicines for all people. So if a monkeypox vaccine becomes available in Australia, then it should be available to Australians through their local community pharmacies. So it's, I don't have anything specific on it for you, but I can assure you it's on the agenda.
Okay, great. We have one more question from Jay Patterson, and they ask, hi, Trent, just wondering when the 8th pharmacy agreement will be signed and what changes you want there to be. Thank you.
Sure. So the Albanese government wrote to all of the Pharmacy Guild members. The letter was addressed to me on the 12th of May, and it says that it will negotiate the 8th Community Pharmacy Agreement with the Pharmacy Guild of Australia, and we will sign it by no later than January 2025, and that letter is public. So the current agreement ends on the 30th of June. The next agreement has to start on the 1st of July 2025. We're due for a federal election sometime around May 2025, so they've committed to do the agreement and have it bedded down and done before they go to that federal election, which is reassuring to give confidence to the sector. What would I like to see out of it? Well, mate, I'd like to see two things. I'd like to see further reduction in out-of-pocket expenses for Australians to remove cost as a barrier to receiving healthcare, and I would like to turn up the clinical scope of practice that you all have. So Australians can receive more clinical services through their community pharmacy. So I want, I want a pharmacy to be able to do more things for more people.
Yep. Thanks, Trent. I think that's all the questions we have. So
right.
Thank you for joining us. And everyone, please stay tuned for session 2 of the summit at 4:30 p.m., which is Myth Busting in Community Pharmacy. It's a Q&A panel where we've got 2 experts in the field to answer your burning community pharmacy questions.
Who are the experts, Annika?
Nick Paniaris and Elise Apollini.
Oh, so they're crackers. Nick's my vice president, and he's the president of the Guild in South Australia. And Elise Apolloni isn't just a winner of Pharmacy of the Year, but she is she's a pharmacist here in Canberra, and she's on the Pharmacy Board of Australia. So 2 cracking speakers. Well done.
Absolutely, and hosted by a third cracker, which is NAPSA Treasurer Georgia Bridges. So which is very exciting.
Gold.
Yeah. So if you haven't registered yet, I've just chucked the registration link in the chat. So thanks everyone for attending, and we'll see you in the next session.
Bye-bye.